Week 14, Chapter 29. This is respiratory, starting our review in the respiratory system. So let's get to this. Our learning outcomes are here, and you can find them in your book on page 524 for Chapter 29. You can do your learning outcomes. This is the anatomy for what we're talking about, starting about what we're talking about for the respiratory system. This is going to focus on assessment and therapeutic measures. So we start in the nasopharynx. You guys can see here exactly what you were doing when you did the COVID swab test, where you were going. And so remember you were saying, what does NP mean? So this is where you were swabbing for secretions to get a sample to send in. The oral pharynx just moves down farther, and then the laryngopharynx is down farther past that. So you can see these illustrated by the colors here. Okay. Continuing on, and these are illustrated in your book, so look at these. On page 525, along with these illustrations, it talks about protective mechanisms. So the nasal hair, mucous membrane, cilia, irritants, those are some things that you need to review to make sure that you know if you don't already know. These are things we've talked about and what their jobs are, okay? Beautiful picture here. This is the trachea. And it extends so you can see how it branches out into the bronchial tree. And then those are the alveolar sacs, breaking down all the way to those so you can see what's going on when we talk about respiratory diseases and those types of things. Medications and treatments where they fill up in the alveolar. This is what we're talking about. So make sure you're familiar with all these. Okay, we know that there's 3 lobes to the lung. So on your right lung, you have the superior lobe, the middle lobe, and the inferior lobe. On our left side, which if you think about your heart being more towards the left, it's in the center, but a little bit off to the left, you only have 2 lobes there. So that's the superior and the inferior. Makes sense? So think of it that way, and here's a good illustration for that. Okay. These are on 526 and 527. You get great pictures. And then further breaking down for that on page 529, the alveoli. So the alveoli are these little sacs that expand and contract. And so we want to have an idea of what those look like. Okay, and then moving on to page 530, this is what happens during inspiration, your external intercostal muscles. You guys have seen this and you heard with auscultation with your stethoscope. So on inspiration or expiration, can you hear wheezes, crackles, like friction rubs, anything like that? And your diaphragm is below that. Here, so if you can see this, air rushes in to equalize pressure. So this is the airflow here, basically. So inspiration, when you breathe in, and then you breathe out, right? So this is what happens to your external abdominals. And why breathing all the way down, filling up your lungs, that's very cleansing also for us and helps us relax. But it involves, so you can see if it goes through the whole process and how your body involvement is more complete that way. In comparison, if you want to think about when you're hyperventilating, what happens when you hyperventilate? So think about those muscles and that process happening in comparison to like deep breathing. Okay. Acid-base balance. This is very important for you to understand. Acid-base balance, and this goes into understanding how to interpret arterial blood gases. I'm trying to see here where in the into the chapter it goes, because then it doesn't stay right along with it. But if you go to hypoventilation is that's how we get acidosis, and alkalosis happens with hyperventilation. So I'm trying to find here in the chapter where that goes along with, but I don't want to exceed my time limit. So just find that in the chapter. It goes right along with and explains. On page 532, the physical examination. This is very important because it's inspection, palpation, and percussion. Has your breathing sounds, respiratory patterns, and goes into the breathing sounds over on page 535. You absolutely know that you have to know this. The anatomy, figure 29.10. The PowerPoint goes off a little bit. The effects of aging, that is on page 530. So it's just right on along that same area. But this is a concept map basically talking about how the process of aging affects our breathing, like with decreased cough reflex, reduced effectiveness of alveolar, where you're more at risk for pneumonias and respiratory diseases like emphysema and those types of things, right? Okay. Health history, what do we gather? So, what upper respiratory symptoms, lower respiratory symptoms. It shows you exactly how to auscultate on page 535. This is taking it way back to semester 1. So go back in your mental file cabinet and look at the anterior, lateral, and posterior places that you auscultate for lung sounds. You can see, ask them about their exposures to either maybe any pesticides, chemicals, of course, smoking, number one offender. If yes, how many years? If they've quit, how many years ago did they quit? Those different things. Are they on any kind of breathing treatments? Maybe they're on a ventilator, things like that. And family history, asthma, emphysema, lung cancers, anything like that. Okay, this is a good acronym. What's up? Where is it? How does it feel? Aggravating and alleviating factors. Maybe if they tripod breathing position to help them, they have to sit that way. Maybe they can't lie down flat completely all the time. What is the severity? Do they feel like they can't catch their breath? Those types of things. Inspection. So this talks about looking at the lung. Does the chest have symmetry to it? Does it look like it is in alignment with each side? Or are there any protruding areas? When they breathe in, their inspiratory and expiratory muscles, how do they look? What is their color? Is there any cyanotic or blue, just grayish discoloration, anything like that you notice? Respiratory patterns again. So you can think about, there's even Kussmaul's down at the bottom. What's the shape? Do they have a barrel-shaped chest? Those types of things that we've talked about and you have now seen at the hospital. Palpation. This is how we're going to palpate in the areas. For respiratory system, sinuses, respiratory excursion, and crepitus. Percussion. These are the things that we are going to percuss. And you're going to you feel those. And then this is what we hear. And these are the placements. Again, that's table 29.4 and 535. You have to know these for your nurse life, right? Okay, lab tests. What kind of serum blood tests can we get? a CBC, and ABGs. This is your arterial blood gases that you need to be very familiar with, along with everything else on this, the D-dimer and stuff. We've talked about this, and you guys look up labs when you're in the hospital. So on page 536 and 29.5, there's a short little table about that. So you can just review that. You do need to be familiarized with these normal values. And what does it mean? So like an increase in hyperventilation, the PaO2 is normal values are 75 to 100. So if it's above that, you're hyperventilating. If it's below, you're in impaired respiratory function. That's just the top one. So just review those. Make sure that you are in good understanding. Chest X-ray. Okay, chest X-rays, your CT scans. These are all the different types of respiratory tests that would be involved. Okay, we want them to quit smoking if they have not already. This is a horrible, horrible addiction. Very, very addictive. Nicotine is very addictive. So you want to offer patches. You want to offer suggestions, even if they said that they have been smoking for forever. Case in point, my mother-in-law, who smoked since the 50s and hated it very much, and not until she got lung cancer and was diagnosed with that and put into the hospital, into an ICU situation, and was forced to. They did not even give her patches. So she had to deal with all of that. So you want to make sure, and she was always saying that you can't quit. I can't quit. I've tried and I can't quit on my own. So this kind of was not on her own, but it was. So they have to have their desire to do it themselves, but you can still offer it. This is for someone, I'm just giving you an example of someone who said, there's no way that I can quit. I'm not feeling like even though I hate it and I know it's bad for me, but she was able to quit, and thank God for that. So there is hypnosis, physical activities, depending on the rest of, do they have other comorbidities that prohibit them from exercising, or are they able to in a place, and that gives them a great advantage because they can see some immediate benefits. These are other things that we want to help for prophylactically not getting pneumonia, deep breathing and coughing. Let's see where we're at here on huff coughing. This is patients with chronic COPD. They have a weak cough and airways that collapse easily. So huff coughing may work better for them. Instruct them to deep breathe and cough as just described. Instead of closing the glottis to generate a forceful cough, the patient should keep the glottis and mouth open. So you can read all about this on pages 538. These are different positioning. Fowler, semi-Fowler is a good lung down. You need to be up, the tripod position, anything like that. You want to keep them elevated because that's for comfort. Here's our nasal cannula. These are different ways that they can get oxygen. There's even a more advanced, you've seen in the hospital, that thing that looks like they're pulling in their nostrils back. That's like for maximum oxygen inhalation. This is a trach diagram here, just to show you. This is a trach tie that goes around their neck, but this is inside. Okay, this is a nebulizer treatment. You all are pretty familiar with that. What goes in there is Openex or albuterol. Usually is what's treated, but the RT, if they're in the hospital, will come around and do this. You can do this in the home if you are the nurse in the home, different things like that. You can also run normal saline and it helps. We do that for breathing treatments. Metered dose inhalers. This is, you guys are familiar with this. Back in semester 1 again, you might be familiar with it yourself. For asthma, COPD, all different emphysemas, different lung diseases, you have inhalers. There's a spacer. This is generally used for kids, but can be used for anyone. Incentive spirometer, you're very familiar with this. This is what we give to them in the hospital or anybody that needs to exercise their lungs, right? It's like preventative, gets air exchange into the lungs, so very good to use and recommended for post-op, any surgeries. We don't want people developing pneumonia. When bacteria sits in these lungs here, that's what happens, right? Okay, so physiotherapy, this is kind of that cupping. You see here, he's patting her. If you could see this, if you can turn them and do this, is excellent. There is a little cup that they have, or you can do it with your hands. There's a different device, a PAP device, also just used for different, this is like the cough assist or oscillating vest, thoracentesis, other measures that they can use for respiratory. Drainage systems, we're looking at here on page 545. If you want to stay with the text, and there's like a pleural evac chest drainage system. You've seen drainage systems before in the hospital where they're chamber, so it's always a suction portion on the wall that's connected to the, like actually like a little stoma into their lung. On the side there'll be a tube. Okay. There we go. That's a diagram that matches the book. What do we look for? So this is like if they have any kind of drainage system, you always want to look for signs and symptoms of infection. With a trach as well, you look at the stoma, look at the area surrounding, make sure that there is a minimal to no redness, any inflammation, any drainage, any discoloration. You want to make sure that bandages, 2x2s, 4x4s are always clean and dry. Change them as needed. This is just more about trachs. You can see here, this is the portion, and it goes back to the diagram of the trach. Okay, I don't want to go too far. It's in your book. It's on page... let's see. Let me catch you back up where I was at. Here. So this is on page 547. And you can see on figure 29.27, this is like a side diagram, again, of where the trach goes in and how it looks. I was looking for the picture that's on 541, that diagram, to reference you back to, a trach and oxygen catheter. So that's just something that you can see how that works together and what parts here are inside and what parts are outside. Like this is the part that's outside of the body, okay? And if these are our options for nursing diagnosis, Passy Muir speaking valve. So people that have trachs, they can speak. That is something that you can, and that you will find that on, along with the trach care on, let's see, pages 546. And it's talking about how these are the different parts of the trach, what kind of care, how it affects their vocal cords when you're intubated. If that has to be put down a permanent trach, this is where they're going, okay? So here is an intubation. This is what they will put down. This is like if you see this in an emergency type of situation, they will intubate somebody. This is because they have no air, no breathing. So it can be someone who has maybe possibly an allergic reaction. Their trach has closed off, so there's no breathing happening, right? They've turned blue, they stop breathing. The heart is going to then stop thereafter, so they will intubate. So they have to make an incision there, and they will insert this intubation tube. So that's just kind of a diagram of that. This is now a permanent trach that's been put down. She's not intubated with that. That's like a permanent trach. That's a ventilator that's on, so mechanical ventilation. This is our nursing care. We want to make sure that the head of the bed is elevated, provide them with oral care. Suctioning is very important. for people that are on trachs ventilators, because they can't really cough too well, if they can at all. And so you want to make sure that you are suctioning them orally, and or if they have a suction indwelling, it'll go into their lung. Nursing care, we just talked about that. Okay, here's the positive pressure ventilation. So that's the mask that they can put on. It kind of looks like a BiPAP machine. Here are your questions. Again, start and stop this video as you need to. Go through it. I just want to make sure that I stay under my time limit so that I can upload these easily for you to look at them. Okay, and those are all the answers. Thank you.